And then what kinds of things can eye exams catch before the person may even know that they have a health issue? What do you tend to see?
I can count a number of patients who I'm doing a routine eye exam on them. I sit back and say, oh, how long have you had diabetes? And they say, I don't have diabetes. I'm like, oh, then I know that's going to be a longer eye exam because I have diagnosed their diabetes.
Oh my goodness.
I remember being a resident looking in a routine eye exam. I did my residency down in Baltimore, and every employee in the hospital got a free routine eye exam through the eye clinic. So all the residents did routine eye exams. And this patient's eye, I can still see it. This patient's optic nerve was swollen. Came in for a routine eye exam. I was like, what is going on? I called my senior resident in. We sent him down to the ER, and he was in kidney failure. So he was an African-American gentleman in his 40s. He had other risk factors. But you can have diabetes, high blood pressure. You can diagnose cancer in the eye. You can diagnose primary cancer in an eye exam. Or, unfortunately, you can diagnose metastatic cancer, where you have a primary cancer somewhere else in the body, and it goes to the eye. Common diseases such as MS, multiple sclerosis, or sarcoidosis. A bunch of diseases will have clinical signs that are in the eye. High cholesterol, high blood pressure. I'll look at a patient. I'll be like, hey, your blood vessels look, very tenuous. They look like they're being pulled or whatever. So you can have patients who have signs of stroke. Your audience is going to know about TIA. Well, patients who come in and say, I've been losing my vision for like 15 minutes a day. And then it goes fine. A curtain comes over my vision. I'll look at the patient. I'll say, ma'am, you're having a stroke, or you're at high risk of a stroke. We need to call 911 and send you to the emergency department. Sometimes when I lift a patient's lid and it's really soft, it's really easy for me to lift, I'll sit back. I'll say, do you have sleep apnea? And the patients will jump back. They'll be like, how did you know I have sleep apnea? I say, well, because there's something called floppy eyelid syndrome, where we can literally just move a lid. And when you've looked at thousands of lids, you're like, oh, it looks like something called a floppy eyelid. And that could be a risk factor for sleep apnea. So at that point, we say, look, you could have sleep apnea, but I'm not going to say you do. So we're going to send you over to our MD colleagues, our primary care physicians, et cetera. But, I've diagnosed brain tumors. I've diagnosed aneurysms indirectly.
Really, it just makes me think that the eye is like a window into a really good picture of your health. So if there's
the one thing I'll tell you, the eye is the only place in the human body that I know of in which you can look at a blood vessel without cutting into tissue. We can look at a lens or take a photo. We can look at arterioles, arteries, and veins. The only place you can look at that in the human body without cutting tissue. You can look right at it in the back of the retina. That's actually really nice. That's cool.
That is so fascinating.